Hi, y'all, and welcome to Professor Truelove's Concepts for Nurses series. And I am Professor Terry Truelove. And in today's episode, we will be looking at the concepts behind rehabilitation, some of the terminology, and some of the goals of rehabilitation. Sources for this episode include Iggy's Medical Surgical Nursing at 9th edition and Soul's Introduction to Critical Care Nursing 7th edition. In the United States, people are living longer and longer. This means that they are also living with things like chronic illnesses, diseases, and the results of things like injuries or impairments. Complications from these account for the majority of death in the United States. People don't necessarily die from disease. They die from complications of those diseases, such as hypertension or diabetes. In addition, young adults are living longer with potentially disabling congenital or genetic disorders. You should also remember that accidents are the leading cause of death among young and middle-aged adults, and in those accidents in which death are not caused, this may lead the patient to require rehabilitation. So, rehabilitation is a philosophy of practice and an attitude toward caring for people with disabilities and chronic health problems. Rehabilitation nursing is recognized as the specialty of managing the care of people with disabilities and chronic health conditions across the lifespan. A disabling health condition is any physical or mental health or behavioral health problem that can cause a disability, while a chronic health condition is one that has existed for at least 3 months. Further terminology includes the word impairment, which is any loss or abnormality of psychological, physiological, or anatomical structure or function. A disability is any restriction or lack, that is, resulting from an impairment, of ability to perform an activity in the manner or within the range considered normal for a human being. A handicap is a disadvantage for a given individual that limits or prevents the fulfillment of a role that is considered normal. As traditionally used, impairment refers to a problem with a structure or organ of the body. A disability is a functional limitation with regard to a particular activity, and a handicap refers to a disadvantage in filling a role in life relative to a peer group. While in rehabilitation, goals include a continuous process of learning to live with and/or manage chronic or disabling conditions. Rehabilitation helps patient return to the best possible physical, mental, social, vocational, or economic state. Rehabilitation restores function in post-traumatic situations. And rehabilitation provides education and therapy for chronic illnesses that are characterized by changes in body systems, body function, or body structure. Crucial members of the rehabilitation team include physicians who manage the type of care given to the patients, nurses and nursing assistants that are specialists in the art of rehabilitation, physical therapists and their assistants who are primarily concerned in this setting with gross motor skills, occupational and/or vocational therapists and assistants. Occupational therapists are more concerned with fine motor skills, such as those required for eating or hygiene, while vocational therapists are those who help the patient acquire skills needed to perform a function like a job out in the world, while speech-language pathologists and their assistants evaluate and retrain patients with speech, language, or swallowing problems. The role of the rehabilitation nurse is to advocate for the patient and family, to create a therapeutic rehabilitation milieu, that is, a setting, provide and coordinate whole person patient care in a variety of healthcare settings, including the home, to collaborate with the rest of the team to establish expected patient outcomes and to develop a plan of care, to coordinate the rehabilitation team activities to ensure implementation of that plan of care, to act as a resource to the rehabilitation team, to communicate effectively with all members of the rehabilitation team, to plan continuity of care when the patient is discharged from the healthcare facility, and then to evaluate the effectiveness of the interprofessional plan of care with the patient and their family. Physical therapists, occupational therapists, and speech-language professionals are collectively referred to as rehabilitation therapists. Their assistants may be known as rehabilitation assistants or restorative aides, and their function is to continue care when the therapists aren't available. Recreational or activity therapists provide the patient with either diversion through gaming, but you should realize that that very action helps to promote fine motor skills, cognitive skills, and problem solving. Social workers help patients identify support services and resources, including but not limited to financial assistance. Spiritual counselors specialize in spiritual assessments and care and are able to address the needs of a wide array of patient preferences and beliefs. While cognitive therapists, neuropsychologists, and clinical psychologists all deal with the emotional and cognitive abilities or disabilities related to either the illness or the injury of the patient that's being presented. All of these activities done by all of these different professionals can occur in a variety of environments. And this is the nature of rehabilitation. It is community-based and can be done within the home via home care management. When doing this, the team should make sure that teaching for self-management is paramount. That is, letting the patient or the patient's family provide the best possible care themselves. And another important concept, therefore, is to provide that patient who's providing the care with resources to provide that proper therapy and care. There are some issues inherent to rehabilitation, one of which is the argument of quality of life versus the quantity of life. Because rehabilitation focuses on continually improving the quality of the person's life and not merely maintaining life itself. So not necessarily extending the number of days, but just making sure that those days are of quality. Another issue is the issue of care versus cue, because many conditions are irreversible. So the focus of care is related to adaptation and acceptance of an altered life rather than resolving the illness or injury. Another issue involved with rehabilitation is the cost. Rehabilitation is extremely expensive, so we have to weigh the high cost of interdisciplinary care and long-term care and how they impact the outcomes. And this is why many people looking at the rehabilitation, that is the reformation of medicine, look to well health as opposed to reacting to illness and disease and injury. The nurse's role in rehabilitation starts with obtaining a patient history. This is information on the patient's present condition, any current drug therapies, or any current treatments. Also to obtain a general background data, that is how they live, what their education is, etc. Their usual daily schedule, what is they do during the day, because we would like to adapt that schedule as much as possible into the rehabilitation schedule. Dietary patterns, and sleep habits. Besides the history of the specific disease or condition or injury that brought the person to rehabilitation, the nurse should do an assessment on the history of the patient for cardiovascular and respiratory problems, gastrointestinal and nutritional problems, renal and urinary problems, neurological and musculoskeletal problems, and a history of skin problems. This is important because although the patient is entering into the rehabilitation for a specific problem, there is probable comorbidities that are occurring. Your patient who comes in after a stroke will probably also have something like diabetes or hypertension. So it's important that we do that type of history to determine if those other conditions, in fact, do exist. That does conclude this episode, but there are more episodes to come. So I hope you learned a little bit. I hope you plan on coming back and listening again. And if you are, we'll see you then. Take care now.